Hey, so a new adventure in my life started back in June. I have kidney stones really bad, so occasionally I have to go to the excuse me, to the ER in order to get some pain meds in order to help pass these kidney stones. Um, so in June, was a pretty bad month for him. I passed several. I had to end up going to the hospital 3 times, I think. First time I went early June, they did a CAT scan, which is normal. I go back about a week later, 3 weeks later. Yeah, 3 weeks later, and another kidney stone. So they do a CAT scan this time, and so they do a CAT scan, and the doctor comes back and tells me they find a mass on my left kidney. So that kind of kicks things in gear for the next adventure, I guess, we're going to take here. So I already had a urologist that I see pretty regularly, twice a year. Can't say that he's done a lot for me, or this particular doctor did a lot for me. I would go in, visit, see him. They would do an x-ray. Hey, how's it going? I'm like, well, I'm still making stones. And he's like, okay, well, see you in 6 months. Come back 6 months, another x-ray, get another $50 out of me, another office visit, and hey, see you in 6 months. So I go to see this guy. He looks at the CAT scan, says that he would like to monitor this particular mass on my kidney, something they call active surveillance, I guess. It is what it is. I'm new at this. I'm thinking he's a professional when it comes to being a urologist and being a surgeon who does surgeries and works with people who have cancer and tumors on their kidneys and the whole urological system. So he said he did want to monitor for a couple months and then schedule a ultrasound to check and see if it had spread or grown any. So we wait a couple months. We get the ultrasound done. The ultrasound comes back. Hey, there's something there. Don't know what it is. But I think additional. This is from the radiologist reading this. It comes back and says, hey, I believe there's additional imaging or testing needs to be done on this particular thing. Okay, hey, cool. So I end up with the radiologist report before my urologist does. So I'm waiting for them to call me, nothing. I call, leave a voicemail or two. Finally, they get back to me. Oh, hey, yeah, you have I didn't speak with the doctor, and I don't know who I actually spoke with at this particular office, but she told me essentially, you have a lobulated kidney. I have no idea what that means, a lobulated kidney. I've never heard that term before. I'm not a urologist. I'm just a steel worker. Kind of a dumbass at that too, but anyway, you have a lobulated kidney, and I'm kind of on the phone, just kind of struck like I don't know what that is. Well, you have a lobulated kidney, and pretty much that's it. Click, hang up, good luck, bye. So, think about this, talk with my wife about it. I'm not sure, I have no idea. I do know that there has been growth on this thing from earlier, prior to this mass being found, or to this ultrasound. So we think, all right, hey, we're going to get a second opinion, since my initial urologist, Greg Hallman in Cape Girardeau with Cape Girardeau Urology Associates, don't have a lot of good things to say about them right now. So, Cape Girardeau, Missouri. Now, whether it's the doctor's fault, I don't know. I figure the people he's got calling his patients back are probably read in and probably know or have a good sense of what, is going on, or they have no idea at all. I don't know. So, unfortunately, my general physician, who's been my doctor since I was born, and I'm 48 years old now, retired in January. So now I have got to find a new general physician or general practitioner to get me a referral to go see another doctor. But really, I'm needing my general physician, this new doctor, Joe Kopecka in Hayti at the Pimscott Memorial Hospital, actually is the doctor in the ER who saw me when I had these kidney stones and actually had the reading where a mass was found. So I wait to get in with him. He's kind of flabbergasted at the urologist kind of just blowing this report off. So he immediately wants to have schedule an MRI with contrast. So we get the MRI scheduled at Southeast Hospital in Cape Girardeau, great hospital. Had several surgeries there. I get the report on a Friday, I guess. Had the MRI done on a Thursday, I think. Report comes back, hey, yes, there's a mass concerning for renal cell carcinoma on the left kidney. The pancreas is enlarged somewhat. So unfortunately, Dr. Kopecka is on vacation that week. But so the next week I get back in. He reads the report immediately, says, hey, where do you want to go? Who do you want to see? So my daughters they're both nurses. They both kind of researched urologist, and they found Dr. Sam Bayani in St. Louis, who works with Washington University physicians and works out of Barnes Jewish Hospital in St. Louis and Barnes Jewish West out in Creve Coeur. He is a urologist, but he does the davinci robotic surgery when it comes to kidney cancer, kidney tumor, kidney masses, whatever you want to call them, lesions. So we get scheduled with Dr. Bayani, and we see him a couple weeks ago. Take the reports. He reads the reports. Has Wash U. Wash U has the physicians or the radiologist at Barnes read the MRI report. They concur, hey, there's something going on. So we have things after this kind of snowballed, so to speak. We've got surgery scheduled for this coming Tuesday, which is going to be November the 8th. They're going to do a partial robotic assisted nephrectomy on my left kidney. The mass is roughly an inch, so I'm guessing it's about the size of a ping pong ball. And when all this started about in June, I guess, when we finally found the mass, it's grown pretty aggressively. It was about half an inch, so it's about doubled in size in just a couple months. So I guess with my age, being 48, still fairly young, not in great health, but not in stupid health either. They're decided they want to go ahead and do this nephrectomy. So we're going to have that done in St. Louis. I will try to post videos from the hospital when I get there, or prior and after surgery, depending on my ability to speak, I guess, or whatever. My wife's going to be there with me. So anyway, it's supposed to be a 2.5 or 3 hour surgery. I'm looking forward to getting this friggin' thing out of me. So the reading, I guess the reading for, I don't know if it's cancer. I don't know. I have to assume that it probably is, or some type of aggressive something. I don't know. But the radiologist report said, very concerning, or I forget the terminology, but concerning, very concerning, or very strange, or very concerning for renal cell carcinoma. So I'm going with that until they get it out and they can test it and figure what they're going to do then. So I will find out more, and I will give you more information when I find out something after the surgery. We'll let you know how the recovery goes. We'll let you know how the robotic assisted davinci XI robot works when it comes to doing a laparoscopic removal of this tumor. So wish me luck. Say a prayer if you pray. I do. And we'll go from there, and we'll let you know how it goes. Thanks. Good luck.